others. And then we can also use some other things. You had asked about, you had talked about intentionality a moment ago. And so another technique that we can use is asking direct questions and using scaling. So I will ask somebody on a scale of 0 to 10, 0 being never would I ever, and 10 being the moment I walk out this door, where are you in your intention to kill yourself? And then we can use that scaling to say, okay, if you're at a 6, I'm going to be worried about you. Right. If you're at a 4, I'm still not going to feel very good about that, but I'm not going to be as worried. That's going to maybe change my framework into what needs to happen next. And then I can use that to say, what if anything could happen that would move you from a 4 to a 5? And then I'm going to get a sense of how, kind of if that person, could easily be moved or not. And then I can work towards protective factors by saying, okay, what if anything can we do in this moment to move you from a 4 to a 3? And we can also use that direct questioning and scaling for desire to die. And it's okay to ask these things, to say, do you have a desire to die? And often, sometimes folks will say, yes, I do. And often I experience that when I've talked with people about a desire to have an escape from pain, that's much more common. I want to continue to live. I just don't want to be in this much pain, and I don't see a way out of that, versus folks who have said, yes, I want to die. And so those are all things that I'd be asking and listening for. And of course, talking about protective factors and mitigating factors is really important in there too.
I mean, I'm just remarking at how many things are going on. I mean, this is awesome. And it also just makes me think about, previously you talked about when at triage, they're asking about thoughts, and yeah, someone could have a lot of thoughts, but zero intention.
Yeah.
It's a different ball game. So how long were you doing this job, Rebecca?
Oh, I worked at the hospital for 5 years.
Okay. Because this to me seems like for a novice person, it's going to be a lot different than for an experienced person. I mean, I would think that. I'm just curious what it looked like for you as you started to gain experience, how you presented. What did that look like for you?
Probably a lot more nervousness, a lot more deep breaths before I walked into each patient room. Also, I'm so grateful that as part of our team, our supervisor was always on call, and the 2 supervisors that I had while I worked there were both excellent about saying, it doesn't matter what time of the day or night. If you have a question or you need a consult, call me. Wow. And that's so important. Consult. We don't have to do this alone. We shouldn't, do this alone and feel like we have to make all these tough decisions. And sometimes, I've found that stepping out of the room and thinking, or giving myself permission to go back in and say, I'm so sorry to come back in here already. I forgot to ask you something that feels really important for me to know. And can you just bear with me for one more moment? Right. And to go back in and, or to, for me, sometimes it might be typing things up and maybe talking to myself out loud to help me work through what am I hearing and what needs to happen next.